There are a lot of interesting discussions occurring here at ACA conference. One of them, Dr. Williams, is a panel that you're on that's called the Oral Manifestations of Mental Health and Addiction. Can you explain what that's about?
Sure. We wanted to emphasize the importance that mental health has on your oral health as well. We talk a lot of times about your physical health, and we even talk about your mental health, but we don't dig down into the weeds and talk about how these things affect your oral health, because your oral health then in turn has a great impact on your physical health.
And how does addiction fit into all of that?
Well, there are certain characteristics of addiction that will predispose you to periodontal disease and tooth decay. Also, there are some addictions that have catastrophic effects on your teeth, such as methamphetamine use. All those things result in increased risk factor for pain, poor nutrition, which go on and have deleterious effects on your overall health. It also goes the other direction because inadvertently some of the medications that we give our patients to treat their mental health also have some unintended side effects on their oral health.
And how exactly, though, can your mental health affect your oral health?
Well, aside from the direct effects of the substance use, such as methamphetamine, individuals that have the severe mental illness have a tendency to indulge in high sugar foods and drinks, high acidity foods. There's self-induced vomiting, and all those things result in abrasion and erosion to the tooth enamel, which break down the tooth structure as well.
So you see more occurrences of this in an incarcerated environment?
Well, it's sort of a one-off because it's specifically we're talking about the effects in the mental health population. But as we know, there is an increased incidence of our mentally ill in the incarcerated population. Also, for example, we know that anywhere from 20 to 30% of individuals just with the diagnosis of anxiety and depression are at higher risk for going on and actually losing all of their teeth.
Why is that?
Because of the effects, they have a tendency to have poor hygiene, so they're not taking care of their teeth, which predisposes them to tooth decay, periodontal disease, gingival, disease, those things. All of those things, when the gum tissue is lost, at a certain point, there's no going back. It's irreversible, resulting eventually in loss of the teeth.
So your advice for anyone experiencing anxiety and depression, particularly as it relates to your oral health, is to pay closer attention as best we can?
Well, the message is to the providers, because we get so caught up in the big points that, again, we forget to dig down into the weeds. And the oral health is one of those specific categories where we need to stop and pay a little bit more attention. We need to make a specific effort to ensure that we do screening for oral health in patients that have dementia, because we do have demented patients in the correctional setting. We want to intervene as soon as possible, because not only is there the inattention to the hygiene, but there's fear and mistrust, like in the geriatric population, in the schizophrenic population, where they will refuse care. So the sooner that we can pay attention to the oral health, to intervene and cut off the bad effects down the road, the better off the patient's going to be.
How challenging is providing health care, overall health care, in a correctional setting?
Well, it's challenging, but I believe we do a pretty good job in the state of Tennessee. We've been blessed to have good partners, and we're very proactive in mental health, physical health, including your oral health and your eyes.
Thank you, Dr. Williams. And come back again tomorrow. We'll have more of our coverage from ACA in San Diego.